Hello everyone. My name is Mohammed Vakas. Some of you may already know me because I do educational sessions and webinars for the Cesr or the portfolio pathway. And a number of times when we do these sessions, one of the most common questions I usually get in my inbox or the comments on my video is uh, the prospects of CCT versus Caesar. um, you know, uh, what are the prospects of Caesars and CCT? Is one more credible than the other? Is one more recognized than the other? Or is one uh, is there same job opportunities after Caesars? Which is the better? So I thought I'll make a short video on that to help you decide choosing one pathway over the other and deciding which one is better for you. So let's start. So before we start, let's who this video who is this video for? I think I is so let's assume that we are talking to the people who already have the eligibility of both Caesar and CCT. So eligibility means that either you have a specialist qualification or you have already completed a specialist training outside the UK. So if you don't have the eligibility, probably this video is not for you. So if I say, or if somebody says that one pathway is better than the other, then probably I think that's a bit unfair. Or I think one should rather say is that one pathway may be better than the other for one person than the other person because it's so individualized and depends upon your developmental needs. We all have different training experience and backgrounds and uh, different personal circumstances. So one pathway may be suitable for the other and not for another person. So I think what I'll do, I'll discuss the pros and cons of each, and maybe that will help you to decide which one is more suitable for you. So let's start with the CCT, the structured training program, the traditional training program in the UK. Uh, so pros are it is more structured, so definitely it's based on the curriculum. There are stages you have to achieve the key capabilities. It is competency based, so you achieve a basic level, then an intermediate level, and then an advanced level, and then how that's how you progress. That is very well monitored. So you give feedback, you receive feedback. There's a deanery, there is, health education England who is supervising. There's a lots of support. So you have a clinical supervisor, you have a educational supervisor, and then you have a training program directors and the lots of support and resources available around. Then another thing is exposure. You are very well exposed to almost all kind of settings like primary care, secondary care, tertiary care, in some cases quaternary care, and your uh, area of special interest in some cases. Then CCT is very well established, more I would say more than Caesar because it's well known. It's a traditional pathway. More people do that, so everybody knows. Uh, Less people do Caesar. Then it's kind of a automatic, a kind of a semi-automatic process. So you go through a checklist. Then there are lots of learning opportunities in depending upon your settings which you are working in. Then we discuss about the cons. So I think pros. So cons, one may argue the salary of the trainee, unfortunately, is not as good as to meet your finances in most of the cases. Then you have a lot of you you have you. have to rotate every 6 months or so in your deanery. That again depends upon the area which you are being trained in. But generally, the deaneries are, uh, you have to commute long distances. Relocations. One option is that you relocate to a new area every time you move, or if you are not relocating, then you keep your family or your household at one base and then you commute, which may be longer or shorter depending upon the setting again. Duration may be a cons because the training can sometimes be long. So even if you start at ST3, so it's 5 years of training. And depending upon your personal stamina and hard work, you can achieve a Caesar earlier or later, depending upon your own skills. But then some people say that although there's a lots of learning opportunities, but they are not very keen to learn because they have already completed training in their home countries, and so they are not very keen to retrain themselves. They have a lot of experience. Then we move to Caesar or the portfolio pathway. Actually, the pros of one pathway are the cons of the other. So the pros in this case are salary. So for example, if you're working at the specialty doctor or associate specialist, then you can have a very good salary. So I was working as associate specialist before I did my Caesar, and my salary was almost close to a consultant. Then relocation. So have you don't have to relocate if you are in a substantive job, or um which is very easy to get in a non-training post. I mean, I don't know. I mean, nowadays it's a bit different. There are less job opportunities, but usually you can easily get a non-training job and SAS role. Likewise, there are no rotations. No rotations required. Um, we have talked about in other in other webinars that you don't have to have community pediatrics and an ICU, so you don't have to rotate. Uh, so, and Because you don't have to rotate, so there will be no headache of commute because you can have your home near your workplace. Duration, again, it's very variable. It depends upon you. If you are very proactive, you are committed, then you can do Caesar in 2 years, three. I know people who have done it in 2 years and 3 years. I have done it myself in around 3 years' time. So again, it depends upon you. So how proactive and committed you are. Cons again. So as I said, the pros of one pathway is the cons for the other. So Caesar is less established because people choose it as a alternate pathway. A second option, it is not many people, especially the supervisors, know about it. Recently, there's been more recognition because of changing in the training pathway. It requires a lot of commitment because most of the work you have to do on your own. It is self-paced and it is very um, easy to lose in trust. So you have to be very, very committed. Support and mentorship, there is a lack of support and mentorship opportunities. I have to agree. And the one reason of that is because there are not many supervisors available in every trust who know the process, know the, who very well know the pathway. Exposure again. So not all the trust or the departments allow you to, explore the other hospital in their trust to go for certain competencies which you cannot achieve. Talking about pediatrics, I can say I don't know about other specialties, but talking about pediatrics, I think if you're working on a DGH, you can easily achieve all your competencies or key capabilities required for Caesar in a DGH in a district hospital. Then another thing is tons of admin work. So there's a lots of admin work you have to do, uh, lots of evidence about 1000 to 1200 pages of that required, and it takes time to get that. So obviously if you are doing the work of 5 years or 6 years in a couple of years, then it's going to take more hard work and more time. Okay. So this is something which I have a questionnaire which I have uh, some data which I've collected by an online questionnaire. I have also presented in the Royal College conference. So about uh, 71 doctors who are uh, you know uh, looking to do Caesar or planning to do Caesar or just uh, considered as an alternative career pathway. So when I asked them why they have chosen, so a vast majority of them have they mentioned that they have enough previous experience in their specialty. That's why they don't want to get into the training program again. Then 21% said that they've, because of their personal reasons, which I will elaborate in the next slide. A small proportion of them also said that they are not eligible for training pathway. That's why they have chosen the uh, Caesar pathway. Then, when asked about the concern and difficulties, 1/4 of them said they don't know where to start from, and a similar portion said the guidance is not enough to easy to understand. And 20% of them said that they don't know what evidence to collect from, uh, and there's a significant portion which uh, ticked a combination of these factors as the reason. So out of these 71 doctors, I think a big portion, half of them, more than half of them, are belong to the group of SS doctors, the specialty doctors and associate specialists. Uh, you know, 10% of them were locum consultants, and 15% of them are a trust doctor, and about 10% have not mentioned their current grade. And when they ask that what do they need, they mention, most of them mention they need support from the trust, they need mentors and supervisors and support groups and webinars. So you can see from this that lots of people are considering Caesar as a uh, alternative pathway, but what they need is mentorship and support. So some common myths which are associated with Caesar or the portfolio pathway. Number one, there is less job opportunities inside the UK. That is not true because in the UK, if you do Caesar, you are on the specialist register, so you are eligible to apply for a consultant post. And when you have a job interview, it's based on the scoring system, so it does not depend upon that whether you have been on the specialist register of, by CCT or by Caesar. So I have been successful in more than one consultant interviews where one of the other candidate was uh, had done CCT. So I can assure that that is not the case, at least in the UK. Number two, less job opportunities outside the UK. That I cannot say. So unfortunately, that is beyond the scope of my expertise. But I know people who have been working as consultants, pediatrician and consultant neonatologist after doing, and consultant intensivist, pediatric intensivist after doing the CCT in the Middle East. In the Middle East, I'm talking about Qatar, Bahrain, and UAE and Saudi Arabia. Then number three is they at the it's specified on their specialist register that they are uh, they they have been on the specialist register after CCT or season. That is again not true. So when you get on the specialist register, you just get a date on which, since when you have been on the specialist register of the GMC, and it does not specify that it is from through CCT or Cesr. Number four, Cesr is longer pathway than CCT. Again, that is not true. Uh, Again, so it depends a lot upon you, how active you are, how committed you are. I know people who have completed Caesar in 2 years. Beware in mind that your assessment of your application can take 6 months to 1 year. So that is again uh, a lot of time, which will start after you have submitted your application. And if you are not successful, then it can take further longer. So it all depends upon your own self. Okay. So in summary, there's no shortcut. Uh, Either of these pathway, they requires a lot of hard work and commitment. Neither of the two are easy, and so you should choose according to your background, training, and experience you have, uh, based on your developmental needs. That what do you need, what do you have already, and what do you not have, and depending on your personal social circumstances, your finances, your family, whether you can drive or not, or how long can you commute, how far you can commute for. So there are lots of social factors also depend upon that. But Caesar is totally doable, and all it needs commitment and hard work, which you anyway need in CCT as well. And so if you need more information about how to do Caesar, what evidence you need, how to upload evidence, how to submit your application, what support you need from the trust, you can watch my other videos about Caesar. So I hope this video has been helpful for you making a choice for your career. And if you have any questions, please post that in your comments, and I'll try my best to answer them. Thank you very much.